Overview: the human skull. The skull is a complex bony framework of 22 bones, excluding middle ear ossicles. It divides into the neurocranium, 8 cranial bones that protect the brain, and the viscerocranium, 14 facial bones that shape the face and support sensory organs. Cranial bones: frontal bone. Frontal bone forms the forehead, roof of the orbits, and contributes to anterior cranial fossa. Important landmarks: supraorbital margin and frontal sinuses. Parietal bones. 2 parietal bones form the lateral roof and walls of the cranial vault. They meet at the sagittal suture and articulate anteriorly with the frontal bone at the coronal suture, and posteriorly with the occipital bone. Temporal bones. 2 temporal bones sit at the sides and base of the skull. Key features: squamous, tympanic, petrous parts, external acoustic meatus, mastoid process. They house the middle and inner ear structures. Occipital, sphenoid, ethmoid. Occipital bone forms posterior cranial base. Features foramen magnum and occipital condyles for articulation with C1. Sphenoid bone, butterfly-shaped central bone that connects cranial bones. Contains the sella turcica for the pituitary fossa. Ethmoid bone, delicate between orbits. Contributes to medial orbit walls, nasal septum, perpendicular plate, and cribriform plate for olfactory nerves. Facial skeleton, key overview. The viscerocranium includes 14 bones that support facial shape, mastication, respiration, and sensory structures. Major roles: mastication, maxilla, mandible, orbital support, zygomatic, lacrimal, and nasal mandible and maxillomandible 1. The movable lower jaw composes the temporomandibular joint, TMJ, mental protuberance, alveolar process for lower teeth. Maxillae 2 form the upper jaw, part of the orbit floor, hard palate, and house the maxillary sinuses. They provide the alveolar zygomatic bones, 2, form the cheek prominence and lateral orbit rim, articulate with maxilla, temporal, sphenoid, and frontal bones. Lacrimal bones, 2, small bones in the medial orbit containing the lacrimal groove pot of the tear drainage pathway. Nasal bones, 2, form the bony bridge of the nose, articulate with frontal and maxillary bones and the perpendicular plate of the ethmoid. Palate, nasal conchae and vomer palatine bones, 2, form the posterior hard palate and a portion of the nasal cavity and orbit. Inferior nasal conchae, 2, curved bony plates that increase nasal mucosal surface area to warm and humidify inspired air. Vomer, 1, forms the posterior inferior part of the nasal septum, articulating with the sphenoid and ethmoid. Connecting it all: sutures and clinical pearls. Major sutures: sagittal, coronal, lambdoid, and squamosal sutures are fibrous, immovable joints linking cranial bones. They serve as landmarks in imaging and surgery.